Hello, everyone. Well, it's good to be here. Daddy, are you here? Okay, he's not yet here. So, I grew up in a family or in a home where storytelling was an after-dinner routine. So if my parents wanted to teach us about a certain value, we would gather after dinner and share stories. And gradually, we became part of our childhood upbringing because we would come with our own stories, they would come with their own stories, and we would learn, we would ask questions, and we were made to participate in our own childhood upbringing. Now, over the years, as a medical laboratory scientist and someone who does storytelling, I've realized that patients, too, can be part of the healthcare process or as essential parts of the healthcare process. And that is where the concept of narrative medicine comes to play. Now, for me, in the practice of medical laboratory science, I figured out that there are two exceptional experiences that I've had, especially from my internship years, that formed the reason for this speech today. And one of them was where I had done internship in the Nigerian Navy Reference Hospital, Lagos. They had this military style of healthcare system where the patient was actually a core part of the healthcare delivery process. So twice every month, we would have mortality and morbidity meetings where everyone, except cleaners, would come together to find out the cause of death of certain patients and to find areas where we could make improvements. And then weekly in the laboratory, we had quality assurance meetings where we had to access information from other patients who had visited the laboratory to know what was wrong and then to fix the laboratory to function as it should. Now, one of the experiences that stood out was, on one of the quality assurance meetings, we had 5 patient satisfaction survey forms where patients had, in detail, told us that they were not satisfied with our services because there was poor ventilation in the reception area. And then they were suggesting things that we could do to make the area easy, to make the waiting time easy for patients who were coming in. And by that, from the meeting and all the things that we had picked together, we were able to not just do corrective maintenance on all the air conditioners that were at the reception area, but also all the ACs in the laboratory. We set up industrial fans, and then we put up a plasma TV with full DSTV subscription packages that made waiting time easier for patients. There I picked the first lesson, that if patients are not involved in the healthcare delivery process, if their stories are not involved, there would not be any advancement of the healthcare system. And the only way to get them involved is to count their stories, their narratives as very important. Now, the second thing that stood out for me was a particular doctor who had a large number of patients on his consulting days. And the reason is simple. Patients wanted to just see him because they found that there was a kind of way he used, or he had his own kind of strategy to dealing with patients. Funny enough, this same doctor is a writer. But then the second lesson is that patients will always stick to a provider who speaks the language that they can understand. So as the patient tells his or her story, they feel glued to the provider that understands and helps them to get to the point of solution by carefully listening to their stories. Now, in the healthcare system, we know that there are gaps. And I know that one of the major gaps is that the healthcare practitioners need to actually pay attention. So there are a lot of things that are involved in the healthcare delivery process, but then attention is key in doing that, because if the practitioner comes to the consulting room or the laboratory scientist comes to the laboratory with an assumption in mind, they are not going to bring the exact results that the patient wants in the delivery process. So that means that inspiration from whatever the patient tells the practitioner, irrespective of their own field of practice, will help the healthcare provider make better decisions and will help the healthcare design to be better for the patient's sake. So now the patient-centered narratives will affect a lot of things. There are other things that are necessary to make the healthcare system work in Nigeria especially. We know that, yes, competency of providers are important, interprofessional collaboration, especially in this climate where a lot of strike actions are going on. We also know that digital advantage is key, as well as the stakeholder commitment. And stakeholders mean patients, the people who visit the hospital, the relatives of patients, investors in the healthcare system, as well as the government itself. Now, what do we now see narrative medicine as? Because knowing that the patient's stories are important and will help to affect every other aspect in this wheel that you have seen now, we need to know really what narrative medicine is. So narrative medicine is the coming together of arts, humanities, and social sciences with medicine to help an effective healthcare delivery process. So the business and the practice of healthcare has evolved or will evolve if the patient's narrative, if there is a sort of empathy, if there's a sort of human-centered or human-driven initiative in the healthcare delivery process. Now, in narrative medicine, we don't just make patients experts of their own narratives. We also listen. We also pay attention to whatever they're doing, because we know that by doing that, we are able to address whatever their ideas or their expectations or their concerns or their needs are. And narrative medicine, or patient-centered storytelling, as the future of healthcare, is going to solve a lot of problems. So by just listening to the patients, by coming with an open mind to know that each patient is as unique as fingerprints, there are a lot of mistakes or a lot of issues that we are going to avoid. And one of them is we are going to eliminate waste. So you imagine where a patient is wrongly diagnosed and then has to run a series of tests. Money is going, money is wasting, patients' relatives. Sometimes they are not even able to afford some of those healthcare requirements or essentials, but then they just have to keep doing it because somewhere along the line there's a mistake. We're going to avoid over-treatment. We're going to reduce errors. We're going to reduce waste. And you know, these are like the core, aside the other ones that are also mentioned. Because by just listening to the patient, the practitioner becomes better informed, comes to notice that, oh, aside the things that I have already read in textbooks in schools, there are also other things that I do not know that makes each patient unique in their own healthcare delivery, in their own healthcare journey. Now, what is the role of the practitioner in doing this? So we know that, oh, we're going to make patients' narratives important. We want to hear their stories. We want to give them something that is essential for a formidable healthcare system. Everybody has a role to play. You as the patient, you as a practitioner. But then the role of the practitioner comes first. The practitioner is supposed to see the patient as the hero of the healthcare story. So in every story arc or storyline, we have someone who is the hero, the main character of that story. And the patient in the healthcare industry is the hero of the healthcare story. So the practitioner or the physician, whatever area of specialty that the healthcare practitioner belongs, sees the patient as the hero. After all, without the patient, there will not be any healthcare system, there will not be hospitals and all that. And then the practitioner comes to the meeting with the patient with an open mind. You don't come with your previous analysis, the fact that, oh, we have read that by the time this patient has this, it is cancer. He has this, it is diarrhea. He has this, it is typhoid or malaria. You come with an open mind. You listen as a practitioner. You listen and you empathize. You listen to understand. You pay attention. You encourage the conversation. And if you're going to give pieces of advice, you don't just say, oh yeah, stop smoking. You give reasons. You don't smoke because in the long run, maybe it would affect your sperm material and you will not be able to have children in the future. You know, so you wrap each piece of advice with a narrative to make that patient know that as much as your story is important, I'm drawing a lesson and I'm trying to give you that lesson in a story format to make it memorable, to not just inspire, to make something last longer in the mind of that patient. And a whole lot of others. The practitioner also should be open to learning storytelling techniques as means of communicating with patients and with other professionals for the good of the patient. And then what is the role of the patient? If you're coming to the consulting room to see a doctor, or you're going to the laboratory, or you're going to carry out a particular procedure, you also are responsible. So gone are the days where we see the practitioners as the god of the practice. I'm a healthcare provider, but I like to make sure that even the patients who come to me are aware to a certain extent that certain things are important. And that is why without them, nothing moves forward. What is your role as the patient? You come to the consulting room to talk with the doctor. The first thing you should do is to also be open. So you start with a high impact statement. Doc, I've been having this stomach ache. It's been severe for 3 weeks. It feels like as if there are pins piercing my stomach. So somehow the doctor has an idea of how severe or the severity of the pain that you're feeling in your stomach is. And the next thing is to give a backstory. Did you have any other sickness before that time? What happened before the stomach, the severity, the stomach ache began and had gotten to that extent of being severe? Then the next thing is to create a circumstance. What was the first thing that happened before the stomach ache? So you're telling a story. It's about storytelling. And then the practitioner is listening empathically to understand patients to speak up. And then to be part of the healthcare delivery process, to come with an open mind, so that by fostering healthy healthcare patient-provider relationship, we achieve a formidable healthcare system in Nigeria and in the world. Thank you very much for listening.